Today, we're focusing on Addisonian crisis. An Addisonian crisis is a serious medical emergency caused by an acute deficiency of cortisol. This sudden drop in cortisol levels can quickly lead to shock, organ failure, and if not treated immediately, it can be fatal. First, it's essential to recognize the warning signs that indicate a serious problem. The signs and symptoms we should watch out for include hypertension, which is low blood pressure and is considered critical. Severe fatigue is another important symptom that often signals something wrong. Abdominal pain can also be a key indicator of an underlying issue. Confusion in a patient is a serious warning sign as well. Most importantly, the onset of shock is critical and requires immediate attention. Because these symptoms can progress rapidly, they demand emergency care without delay. An Addisonian crisis happens when the body cannot produce enough cortisol, which is a vital hormone for managing stress. This condition is often triggered by factors like infections, injuries, surgery, or abruptly stopping steroid medication. In essence, any form of acute physical stress can set off this dangerous crisis, making it crucial to manage these triggers carefully. This slide outlines the emergency protocol we must follow without hesitation. First, we prioritize immediate treatment, treating first and confirming the diagnosis later. The process begins with stabilizing the patient through ABC assessment, cardiac monitoring, and rapid IV access. Next, we move to administering high-dose hydrocortisone right away, without waiting for lab results. Then, aggressive fluid resuscitation is crucial, using rapid 0.9% saline, and adding dextrose if the patient is hypoglycemic. Finally, it's essential to identify and treat the underlying trigger, such as infection, trauma, missed steroids, or other stressors. Remember, calling emergency support early is vital throughout this process. Now, let's focus on long-term protection and management for this condition. First, it's crucial to take replacement steroids consistently and follow the prescribed glucocorticoid plan closely. Never stop your medications suddenly without medical guidance, as this can be dangerous. Next, understanding your sick day plan is vital. You need to know when to increase your doses, when to use emergency hydrocortisone, and when to seek urgent medical care. Lastly, always be alert to warning signs like severe weakness, vomiting, confusion, or fainting. These can indicate a crisis and require immediate action. You must act fast by administering prescribed emergency steroids and seeking urgent medical care without delay. Keep an eye out for symptoms like shock, vomiting, weakness, confusion, or severe dehydration. The good news is that with prompt treatment, recovery is possible. Remember, when in doubt, always treat urgently and never wait for symptoms to worsen. To stay informed with the latest updates, make sure to like, subscribe, and share medical briefs. Your support helps us bring more valuable content directly to you. Good luck!